IVF, or in vitro fertilization, is becoming increasingly common. Last year, the Pew Research Center said 42% of adults said they or someone they knew used fertility treatments. But the high cost and lack of coverage for many keeps it out of reach. That leads some couples to leave the country for treatment. NBC5's Allie Spilliards takes a look at one couple's experience with fertility tourism.
Hi, baby boy. Mama, change your diaper, okay?
In the early days of parenthood, life is a little bleary-eyed. Still, no matter how much life has changed since the arrival of 2-month-old Daniel,
Nice job.
Danea and Miguel Newman wouldn't have it any other way.
It takes a toll, but you know what? The joy of having your baby boy or having your child, looking into his eyes, and because I remember when I didn't have him, you know, and I remember when what all I did to have him here.
Danea and Miguel married in 2016. A few years later, they decided to grow their family.
When we got to that point, we're like, let's start trying. And we tried, and she got pregnant, and then I think it was what,
7 weeks within the pregnancy, I had a miscarriage.
The next couple of years became a blur with surgery and 2 failed rounds of intrauterine insemination. Doctors told the couple their best shot for successfully carrying their own child was in vitro fertilization, with a price tag close to $35,000.
What's it like when this is the thing you want most, to start a family, and you're faced with a price tag like that?
It's heartbreaking because it seems as if it's
beyond our reach to an extent.
With fertility and IVF, traditionally, you have to do it on your own, so it seems very expensive.
Dr. Julian Escobar is a fertility specialist in Dallas. He says IVF, which involves fertilizing an egg with sperm in a lab, is underutilized in the U.S., though trends are shifting.
After the pandemic, we saw a huge rise of patients that have now fertility coverage. I think employers realize how important it is. They are providing now to many of my patients fertility coverage, probably over 50% of the patients. We never saw that before. So it's really changing the landscape.
Still, many couples are forced to extremes. Some take out loans. The Newmans joined the thousands who've sought care abroad.
And we're like, all right, if this is the only option we have, then we just have to do what we have to do.
Yeah.
Through friends, the couple learned of Barbados Fertility Centre, where IVF, airfare, and 2 weeks of lodging cost them $16,000, less than half of what they were quoted at home. From Little Elm, Danea spent a month preparing her body with dozens of injections. Then it was time to pack up and go.
If everything is going as planned, you go there for 2 weeks. You do doctor's visit so they can monitor you to see how you're progressing. After 1 week, you do all that, and then the second week, that's when you'll start doing the transfer.
For Danea, that required a follow-up trip. But soon, all that was left to do was wait.
They say you have to wait like 10 days. On the 10th day, when you go to take the pregnancy test, you take it at 5 a.m., right? I could not wait until 5 a.m.
That was done way before 5 a.m.
I went and I took it and I saw the pregnant, and it was the happiest.
On August 3rd, Daniel Newman came into the world. Weighing 7 pounds 4 ounces, he was a long-awaited answer to prayer.
So to see it all come full circle is like, it's so big. It's just, I don't have words to explain it. It's just so amazing.
The Newmans say they're so confident in their choice that they'll soon make a return trip. Hopefully bringing home a little brother or sister for Daniel. In Little Elm, Allie Spilliards, NBC5.
Precious baby.